Good morning, Rebecca. How are you feeling today?
Good morning, Dr. Thomas. I've been feeling pretty awful. My throat has been really sore for the past few days.
How long have you been experiencing the sore throat?
It's been about 4 days now. It started as a slight irritation, but it's gotten worse each day.
Are you experiencing any other symptoms along with the sore throat, like a fever or a cough?
Yes, I've had a mild fever on and off, and there's been some coughing, but it's mostly my throat that's bothering me.
Is the pain in your throat constant, or does it come and go?
It's pretty constant, but it gets worse when I swallow or talk too much.
Have you noticed any changes in your voice, like hoarseness or difficulty speaking?
Yes, my voice has become a bit raspy, and it's been hard to talk without feeling pain.
Any difficulty in swallowing food or liquids?
Yes, it hurts to swallow, especially solid foods. Even drinking water can be uncomfortable at times.
Have you noticed any swelling in your neck or under your jaw?
Yes, the area under my jaw feels a bit tender and swollen.
Do you have any history of allergies? Sometimes allergies can cause throat irritation.
And I do have seasonal allergies, but this feels different from my usual allergy symptoms.
Have you been exposed to anyone who was sick recently, maybe with a cold or the flu?
Not that I'm aware of, but I work in a busy office, so it's possible I picked something up there.
Have you tried any over-the-counter medications or home remedies to ease the sore throat?
I've been taking some throat lozenges and drinking warm tea with honey, but it only helps temporarily.
Have you noticed any white patches or spots on your tonsils or the back of your throat?
I did take a look, and I think I saw some white spots, but I'm not sure if it's just irritation or something more serious.
Do you feel fatigued or more tired than usual?
Yes, I've been feeling more tired than usual, even though I've been trying to rest as much as I can.
Any headaches or body aches along with the sore throat?
Yes, I've had some mild headaches, but no significant body ache.
Have you noticed any unusual taste in your mouth, like a metallic taste or anything different?
And oh, nothing like that. Just the usual discomfort from the sore throat.
Have you been able to maintain your appetite, or has it decreased because of the pain?
My appetite has definitely decreased. It's hard to eat when swallowing is so painful.
Have you had any recent dental work or dental pain that could be related to this?
I know. I haven't had any dental issues recently.
Do you smoke or use any tobacco products?
I know I don't smoke or use any tobacco.
Have you been drinking enough fluids like water to stay hydrated?
I've been trying to drink more water, but it's hard when it hurts to swallow.
Do you have any known medical conditions like acid reflux that could be contributing to the sore throat?
I do have acid reflux, but it's usually under control with medication. I haven't had any major flare-ups recently.
Have you been under a lot of stress lately? Stress can sometimes make symptoms like sore throat worse.
Yes, work has been pretty stressful lately, and I've noticed the sore throat seems to get worse when I'm more stressed.
Have you taken your temperature recently? What was the highest it got?
The highest it got was around 100.4 degrees Fahrenheit, but it's mostly been hovering just above normal.
Have you been able to sleep well despite the discomfort in your throat?
Not really. I wake up several times during the night because my throat feels dry, or I start coughing.
Have you had any recent infections, like a cold or sinus infection, before the sore throat started?
That I had a mild cold about 2 weeks ago, but it seemed to clear up before the sore throat started.
Do you recall eating or drinking anything unusually hot or cold that could have irritated your throat?
Not that I can think of. I've been sticking to my usual diet and drinks.
How are you feeling overall, apart from the sore throat and the symptoms you mentioned?
Overall, I just feel run down and uncomfortable. I'm worried it might be something serious, since it's not getting better.
I understand your concern. I'll take a closer look at your throat and check for any signs of infection or inflammation. Based on what you've told me, it could be a viral infection, possibly something like strep throat, or even related to your acid reflux. We'll also consider any other possibilities once I've examined.
Thank you, Dr. Thomas. I'm just hoping to get some relief soon.
After the examination, I'll recommend the best course of action to help you feel better as quickly as possible. Let's start by having you open your mouth so I can take a look at your throat.
All right, I'm ready.
Great. Open wide and say ah.
Uh,
Thank you, Rebecca. I can see some redness in those white spots you mentioned. I'm going to swab your throat for a quick strep test. It'll only take a few minutes.
okay, I'm ready.
Just a quick swab. There we go. Now, while we wait for the results, let's talk about some things you can do to ease the discomfort.
That would be great. I'm willing to try anything at this point.
I'm going to prescribe some medicine you may find it helpful. But if you do not find it helpful, just visit me after a few days later. Thanks for coming here. Be safe. Bye.